I'm Lisa Ferentz. One of the more common things that I see in my practice as a trauma therapist is the phenomenon of dissociation. When I talk about dissociation, I'm talking about the client's ability to kind of zone out, space out. Often they look away, they break eye contact with the therapist. They will see our mouths moving but not really hear what we're saying. And you can sense this when you're sitting in session with a client because they miss part of the conversation. They're just sort of a beat behind. So when our clients do dissociate, it's important for us as therapists to understand that this is always indicative of feeling threatened in some way. Dissociation doesn't happen for no reason. So there's either the experience of internal threat or external threat. And it's very important if you see a client dissociate in session that you acknowledge it, obviously in a non-shaming kind of way, and really try to help the client to process and unpack what was it contextually that caused the need to dissociate in that moment. Often it has to do with the content of the conversation, but it might be something sensory that's happening in the room or internally for the client. The thing about dissociation is we have to let our clients know that we're never going to take away their dissociative ability. For most clients who use dissociation, this is their number one coping strategy. And it's something that they got brilliant at doing at very young ages because they couldn't physically escape a situation or a relationship that was unsafe. And so they learned to mentally escape. So the problem with dissociation, though, is that the thing that saved them in childhood is now the thing that can often re-traumatize them in adulthood. We want to help our clients to understand that they have choice about their dissociative process. So when clients begin to understand the physical harbingers of their dissociation, which might be a headache or a tingling sensation or peripheral vision loss or tunnel vision, we want to invite our clients to name the process as dissociation because that brings them back into the prefrontal cortex. And we want to invite them to say to themselves, is it in my best interest to go to the ceiling, or is it in my best interest to stay grounded and present? If they choose to stay present, our responsibility is to give them the tools that they need to be able to stay present. I find things like aromatherapy, holding onto car keys, naming the things that they see around them in the room are some quick ways that you can help them to reground.